My name is Liza Ragasa, and I am the program coordinator for the COPE Health Scholars programs in admissions, as well as the site operations at California Hospital Medical Center in downtown LA. I am also the program coordinator for many of our custom academic partnerships, including this with Keck Graduate Institute. I've been working with Dr. Levitin for a little over a year on supporting the master's thesis program and getting the KGI MS students into our hospital sites to gain the clinical research they need to execute their theses, as well as with Dr. Jun Kim and his post-bac students in getting them to our health scholar programs and getting them the patient care experience hours they need for either PA school or med school. And COPE specifically stands for Community Outreach, Prevention, Education. Just as a little background on our firm, 20 years ago, our CEO decided that him and his pre-med friends wanted to get real patient care experience. They have done shadowing with different hospitals and different doctors, but not really getting into feeding the needs of patients and actually getting that direct patient care. So what they decided to do was go to different underserved institutions that needed basic health assistance. So in Santa Monica and Skid Row with homeless populations, and inserting themselves into a place where they can give a little bit of medical assistance that they knew how to give and gain the experience that they can really use to justify them going into med school and then becoming frontline clinicians, saying that I know what it really is like to treat patients. So that was the basis of our hospital, our healthcare firm. And 20 years later, we still have that educational and workforce development suite, but we also have grown into a leading healthcare consulting firm for population health, for risk analytics, and the transition that many hospital systems are doing from into value-based payment models, which is a really great trend to see, and we're really happy to be part of these better trends in healthcare. That being said, I'm representing the educational and workforce development firm, COPE Health Scholars, where we continue to match pre-health students that want to become frontline clinicians or healthcare administrators with the workforce that they need to gain that relevant experience for graduate or professional school. And the master's thesis program with KGI is just one of our shining examples of how we can connect students to what they need. So we're also just going to go over a higher level overview as well as some of the details for your commitment to the program should you apply. We'll also go over the hospital sites that have decided to submit project proposals, which will be approved within the next month. We'll go over the projects specifically from last year and some of the students who have taken those projects, what their outcomes were, as well as what you'll be able to expect in your day-to-day, as well as seeking admission into the program. At the end, you'll be able to ask me any questions, but of course, my contact information will be there, because sometimes the minute you close out the window and you hang up the phone and you say you don't have any questions, you try to do something and you realize you have a ton of questions, so you'll be able to contact me after. On a very, very high level, what we're doing is connecting and leveraging our hospital and health system partners with students who are seeking clinical experience to gain research for their theses. What that means is that you'll be able to be taken into and matched with a specific hospital system with a gap they want to address or a system they want to improve. And you'll be taken in by an on-site advisor, someone who has a lot of experience and background in that specific project. They'll be telling you about the project, giving you background on it, preparing you to address, analyze, and collect data for you to make your own decisions on where else it needs to go. Of course, there will be a steady scaffolding of background and resources and suggested tasks for you to do, but largely what we're seeing is that this is driven so much by the critical thinking and the operational execution of the KGI students. So you will be able to not only say after this, you have worked with a real health and hospital system, you have gained exposure in systems improvement, and you have created something that you'll be able to put your own name to when you apply to your med school or professional school. I was able to assist Providence St. Joseph of Orange with hospital-acquired infections or pressure ulcer prevention. And you'll be able to say that this system that they now use is something that I did and implemented. Not only that, you'll be able to work with a lot of individuals within the health and hospital system. You're going to be working with an interdisciplinary team. The difference between maybe research you might have done in college where you're doing a lot of bench work with your PI and with your other colleagues, they're all more focused on one specific thing, one specific career goal. You're going to be working with so many different frontline clinicians, healthcare administrators, even caseworkers, even financial officers. One of our latest KGI students actually currently at Hollywood Presbyterian Medical Center in Los Angeles, he actually had an audience with our CHA's hospital system's chief financial officer because of the work that he's been doing with their bundled payment model. So there are so many ways for you to gain exposure to these different healthcare careers, but also gain the networking and the mentorship that you will need to really activate your next step into med school, activate your next step into gainful employment within this health and hospital system. So there's so much for you to be able to do in this program. All we're going to do is match you with a hospital system, match you with your department, and give you the scaffolding for you to make your own way within the project. Sample projects include a lot of basic initiatives that hospitals are always looking to try to improve, such as pain management, cost control, infection prevention. Infection prevention, I'm going to say, is probably going to be really big because of the current healthcare climate and the awareness surrounding COVID-19. So if you're interested in working in specific sample project topics, you'll be able to select from the many projects that are going to be approved within the next month. After you apply, we'll give you a form to select a specific project or the specific hospital that you want to be matched with within our availabilities. Last year, we had several projects that first maybe started off as topics, but then turned out into so much deeper initiatives that have been executed so far. You will be able to listen to some of the experiences of our individuals who have done projects with Adventist Health Glendale in stroke outcome, as well as in Kaiser Riverside for acute coronary cardiac rehab. We do have about 22 sites throughout Washington, Hawaii, and California, but mostly all of the hospital sites that have been sending in projects are the ones that have been within 1 hour commute of your school. Although we might be expanding that, especially if we continue to do this web-based model, but more than likely the hospital sites are just going to be in LA County, Orange County, and Riverside. What you can expect on a weekly level is a commitment of 18 hours minimum. So from September 1st, if you join our program, to May 31st of the next year, you'll be basically doing 3 6-hour shifts every week, or the equivalent. What you can work out with your advisor or your department based off their needs, the location of the hospital, and your ability to commute. You can do maybe 5 4-hour shifts every week if you are able to do a shorter time and more commuting. If not, you'll be able to mold this based off your schedule as long as you're hitting that 18 hours of work throughout the weeks from September and May. Of course, we'll allow you to do winter vacation and stuff like that. You don't have to come in for Christmas, but that's about the equivalent that we're going to have expected of you within those 18 hours. Of course, you're going to be doing your clinical research, you're going to be drafting, you're going to be writing, you're going to be out in the field on the floors doing whatever you need to do, as well as having check-ins specifically with your advisor and your program manager at the hospital site. So first, it's going to be basically once a week because you're going to need more support throughout the first quarter, and then you'll just do monthlies, and then quarterly you'll have a check-in with the program manager. These are the kind of times where you can ask for more resources. Maybe you need more data, so you need to get access to the hospital's Cerner equipment or something like that. You'll be able to ask for these resources. You'll be able to present on your findings. You can move the trajectory. These meetings are really for you to tailor and ask for the resources that you need to better move your project along, as well as it just allows you to have access to someone who can advocate towards you for the rest of the hospital. Say if there's something you do need or research or data you want access to, or department floors that you think that you need to round on, you could just bring it up at these meetings. It's really specifically for you and your the project. This was one of the projects that was submitted last year. It was specifically a very vague project on improving cardiac rehab. Dr. Elka staff at Kaiser Riverside sent 2 projects in, and the basis was they want to make sure more people that need to be in cardiac rehab are getting to cardiac rehab. Savannah did so much great work with this and found the basis of this project is that in her findings, you need several indicating illnesses to get into cardiac rehab. Atrial fibrillation was not one of these indicating diseases, and she was basically taking research and advocating that people with atrial fibrillation might have a good deal to gain from cardiac rehab, and then looked at the data on why, and now you can really see that this individual was looking at a problem, a really big problem, that cardiac rehab needs to be utilized and improved. And then went into the finer detail, went into the data and said that it looks like people with AFib can benefit from rehab, but unlike things like CAD, they're not getting referred to rehab. So let's look at the data, present it, so it can now be one of those indicators. So now individuals with AFib can get into cardiac rehab on referral. Another individual that really did some great work with their project last year was SOS. So Adventist Health Glendale has been sending the same project to us for several years. And this project is a stroke project, improvement of the stroke response time, improvement of the stroke program in general. So what SOS was working with was actually, yes, taking a specific role within our emergency department at Adventist Health Glendale, the stroke champion, and creating that role for a nurse or a NP can hold for that 12-hour shift. So there will always be a stroke champion in their ED, and that was designed by SOS with the assistance of Michelle Jackson. But they actually executed a project or a position within the ED to improve the time it takes for an individual to come in to the ED with symptoms of a stroke for them getting treated, because that's a very, very important time. Not only that, she also started working with Dr. Gregorian, who is doing more of the research, data research, and not very sure what that project is, but she's going to be published with him later, because the work that she's been doing. So she went in to Adventist Health Glendale with the Stroke Improvement Project, executed something in healthcare management, creating a role and an initiative for them to hold, as well as worked with a specific neurointerventionalist to actually publish research. So doing multiple things to improve the stroke program at Adventist Health Glendale. It's pretty crazy the amount of work that you can do to improve a system in these projects. Not only that, she did say something in her interview more about the experience in the project, what she's gained, and what her colleagues have said about their experiences at their hospital systems. I do want to share that with you. Let me just go ahead and find it. Tell me if you hear this.
Typically,
yeah?
Regular day for me at Adventist Health Glendale, it really is different every single day, which is amazing. So, I do a lot of data analysis. I kind of use the patient chart. I really, I look at, medical records, and I schedule. We have a stroke alert log, which I fill out. I input all the data into our Excel sheets, our access databases. I go to the monthly stroke meetings we have. I really on site when a stroke happens as well. I've been, I've been put in the surgery room with the operating room. So I really just see that everything from the time they come in to the time, they're an inpatient post-PPA administration, or sometimes even post, mechanical thrombectomy. And so there really is a lot of work. I'm actually working on publishing a paper with Dr. Morton as well, and this is a little unrelated to our project, but it is a side project just for data extraction. And so there's, you really do a lot. Even like hearing my other colleagues and classmates from KGI do a lot of them really do put in quality work, and a lot of these projects and things that need to be done, but we just have the bandwidth within the office to get it done, so we try to come in and help with any kind of missing rules or gaps with the team that we work with, and essentially kind of help to obtain results. And specifically with the clinical research route, it's really just about improving patient care somehow, somewhere. So, yeah.
Awesome. So to be part of the program, you do have to apply. That application will start with an online portal that has a couple of essay questions, as well as information that we request of you from your background, such as your resume or CV. Once selected into the program, we will of course give you the selection of different projects at hospital sites, part of this application, and then you'll be able to rank them as your top 5, and based off of that, you'll be able to get matched with a hospital system and project. That's when your on-site or virtual interview will take place with the on-site advisor and the PM. This is more of a candidacy assessment, whether you are fit for the position at the hospital, fit with the department specifically, and if you pass that, then you'll actually join that hospital system with a background check and clearance requirements that are site-specific. Some of our hospital sites want titers instead of vaccines, but you'll receive your badge as well as a uniform, which is our Cope Health Scholar polo. Largely, we see that our KGI students don't usually wear this uniform. Most of their advisors either want them in the hospital scrubs provided by the hospital, or in business professional or business casual, depending on where you're joining them in the hospital department. But should they decide that you are able to wear your uniform, we will give you that as well. Of course, you will have to actually join the Health Scholars with a written exam based off of 10 hours of didactic education that we will give you. That being said, don't think of it as another thing you have to do. Really consider this more education and another opportunity to create that foundation of service excellence, of preparedness for you to be in the hospital. The competencies in this 10-hour educational module that of course you'll be able to do at your own home, at your own pace, is all of the information that not only you as a clinical researcher or an intern will need to be successful at the hospital, but basically what everybody within our hospital network needs to be competent with. Things like, of course, HIPAA, background of accrediting and licensing, basic standard safety precautions for patient care, national goals for where we want patient safety to be, but as well as things that are soft skills that you'll need to develop anyway to be successful as a clinician, such as cultural competency and how to treat patients in an ever-diversifying waiting room. Like our hospital is getting more and more diverse, which is good. So this is going to be a lot of information on how to communicate effectively and appropriately to individuals of all different ages, of all different backgrounds, socioeconomic classes and cultures, as well as information on that you can use towards workforce development, such as project management, system improvement, and professional development and public speaking. So I think that you'll really benefit from the 10 hours of education that we'll give you. But even if you don't think about it like that, you still have to learn it anyway because you have to pass the exam in order to become a program participant anyway. But that being said, that is all I have prepared for you today. We want you to apply by May 1st at midnight. And this is the link to our online application portal. It will also be sent to you if you don't have it already. And you can go ahead and screenshot admissions email. But more importantly, if you have any specific questions, you could also email me or contact me via phone if you have any pressing inquiries. Let me know. Go ahead and screenshot that. And I'll open it up for any questions. Does anyone have any questions?
I had a question about like just the interview process, like what it entails, like what kind of, not like what kind of questions they're asking, but like what they're kind of looking for with the interview specifically.
So the interview will not be not be more of like a set of questions throughout each site. It's going to be very specific to the advisor and the clinical director at that hospital, what they're looking for. But just across the board, they will look for professionalism. They will look for time management skills and leadership. Basically, are you the type of person that they can give this project to and for you to make your own educated workflow with, or is it someone that that you would need to take more time with, hold their hand a little bit more, and then more comfortable executing projects. Some people want their projects to be run through with individuals who have more of that analytical and preparedness to take the project and do their own thing and work with the resources that they're given, rather than someone who is a little bit more, who appears to be more of, I will execute the project, or I will execute this task, tell me what to do. So maybe we're try to focus on time management, leadership skills, assertiveness, your ability to adapt to different issues. But it really will depend on each and every director that will do the candidacy assessment. We don't have set inquiries that we use, but largely when I do hear feedback from our program managers or our on-site advisors, it's on professionalism, professional speech, the way that they appear, because I know we shouldn't be judging books by their covers, but what we're doing is putting you in front of our staff and in front of our patients. And if you look or speak in a way that doesn't make them automatically trust in your professionalism, then we probably won't put you out there. Did that answer your question?
Yes, it does. Thank you.
Any other questions?
Hi, Liza. My name is Christian. One of my questions is, are there any limitations to what we can and cannot do while working on the project?
Yes. So that'll go in further once you go through the application. Each site is different. For instance, you might be able to help with vital signs with one site. You might be able to not be able to do any clinical patient care at other sites, depending on your project. But largely, you are going to be focusing less on clinical patient care and more on the collection of data and analysis of the data. So it's not necessarily hard limitations, although of course there are many site-specific things. Most of our hospital sites are okay with you going into procedures to observe. Some of them need you to be in full scrubs. It's very site-specific. All of the project limitations have already been handled before you even apply. So some of the projects that have been rejected include projects concerning pregnant women and research on topics that we have already decided that we don't want any Cope Health Scholar students or KGI students doing. So largely, all of the limiting factors have already been taken care of. Most of the site-specific limitations you will get are going to be largely small, like you cannot do direct patient care alone or something like that.
Okay. And like elaborating more on like gathering data, you said like we're collecting data and analyzing it. Are we the ones that are going to actually like go in with, let's say like a notebook and just record something? Or are we going to actually like look at a patient's chart and then have to block out their name and record their data from there?
It really depends on your project, but largely it's going to be working with already collected data. So you're going to be either given access to their medical recording system, downloading data into a more digestible way, making charts like that, or there could be times specifically, I remember there's a project on patient experience, going with a notebook to different rounding on different departments, specifically asking about the experience the patient had that day, how many times the nurse checked in on them, had their medications been properly explained to them, things like that. And they do have that notebook and they're writing down field data. So it really depends on the project, but largely it's going to be data already collected from either a medical recording system or someone has already done that background for you, if it's a large amount of it. But again, things like field data could be used depending on projects, specifically things for infection prevention. If they ask you to go rounding and seeing how many times individuals do proper PPE donning and doffing, or hand washing or hand hygiene, you might actually be asked to do field data. A large amount of the analysis would be pre-collected data from their medical recording systems.
Okay. So how are we supposed to impose changes to our project? Like, how do we have to create a plan and then show it to our advisor and then have them look over it and then go on the floor and then go to the appropriate people and tell them this is the plan, this is what you guys need to change, or how does that work?
Basically that. It does sound a lot more difficult than it seems. I've been there very overwhelmed when trying to implement systematic changes to hospital health systems. But as long as you have very good data and background on why this change needs to be implemented, why this policy needs to be approved, why this new initiative should be approved of, you will present that to you. Of course, you're not going to go into the CNO's office and say, this is what I want to do, you'll first be presenting your data consistently with your advisor, and they're going to be giving you the directions like, okay, you know what, this looks good. I don't think this thing is feasible because you are not paying attention to this aspect. They'll be able to constantly be helping you shape and mold your project and your analyses and your data. And eventually, when it comes to a time like, wow, this is great. Of course, your advisor is someone who works in the hospital, who has been working in that hospital, in that department, and with that topic for a very long time. They're going to know what is feasible, what is not feasible, and how to translate your suggestions into something that they can actually bring out. Once it gets to that point, they will connect you to, okay, now we have to talk, because this is going to be in multiple medical office buildings, we first have to talk to the director of EVS about something or other, or now we have to connect you with this. And then they'll give you those connections and say, email this person or go meet with this person. They'll schedule these warm handoffs so you can be connected to individuals. Or you can just have all of the processes made with them already, and they can just go ahead and put it into implementation themselves. They will walk you through it step by step. You're never going to be put into a position where you'll have to execute all of this operationally without the tools to do so.
Okay. I'm sort of imagining like the first couple of weeks in the program, you're getting oriented to like the hospital environment, the staff that you're going to be working with. And then you'll meet with your advisor, and then from there, you're going to start analyzing the data. That's how I'm imagining it to be.
Yeah, and actually that's basically it. So the first couple of times that you're going to be coming to the hospital, you're going to be given very specific tasks and introductions by your advisor. They're probably going to be with you the entire time you're at the hospital for your first couple of shifts, walking you through if you need clearance through medical recording systems, like what to look at, how to use this portal or something like that. You'll get a hospital tour as well. They'll show you, oh, okay, this is where our lab is. If you ever have to get something from the lab because of the data that we need, this is where it is. Eventually, like in all different training periods, you will be able to do all of that yourself. And so you'll be able to work less and less with your advisor, except for these weekly and monthly check-ins, where you are able to present your findings, show them the gaps that you run across. Of course, you'll be in constant contact with them. So even in the middle of a shift where you find yourself locked out of I don't know, information about post-discharge calls or something, the file disappeared, you'll be able to call them and ask. So they will be by your side for the first couple of shifts until you are comfortable and have that autonomy where you can do the research and analysis yourself, and then you can go ahead and go from there. Again, all very fluid, but it's going to be very similar across the board.
Okay. What's like the number one piece of advice that previous students have told you that helped them out, or they would like to pass on to like the incoming cohort of students?
I'm not going to pretend like I asked that question to them, but of the individuals that I have had check-ins with, they are really reflecting the idea that the more you put into it, the more you get out of it. Because what you can do in order to do the bare minimum is go in, like I said, and do exactly what your advisor says. Ask for a task, execute that task. Do that until the end of May, be able to gain enough of their data and their analysis in order to write your essay, and that's fine. That's the bare minimum, and you will be able to leave this program, and you probably will be able to have an okay thesis. That being said, all of the best experiences that I've heard about from different students are when they have either found specific interest in the topic that they're learning about, and they immerse themselves into that, or they drive to do more and actually drive their programs in a way that they gain ownership of it, and it's more of the advisor giving them the tools and resources to do exactly what the student wants. So largely it's what you put into it is exactly what you're going to get out. You don't have to go above and beyond in order to go through this program, but it's not going to be as fruitful if you do.
Yeah, can you hear me well?
Yes.
So I guess you kind of answered it, but to continue, is it going to be a disadvantage if we haven't had research experience like this before, especially like when you're doing the interviews and the like the people that are looking for participants are looking for a specific factor within us. So is there going to be a disadvantage or yeah?
What I would say is that the only disadvantage you'll have if you don't have prior experience is the confidence going into an interview. If you're able to go in confidently and interview and lock down a spot because you have expressed all of these transferable soft skills like good public speaking, professionalism, critical thinking, and you do match with a hospital site, they won't have any prior expectations from you other than whatever you put on your resume, such as being able to use Excel and be able to learn some of their data systems. Working with some of these project leads, they really just want a graduate level student to be able to take on this project in a new perspective and execute it with the bandwidth that they don't have. So they won't expect you to have any specific background, and you won't be penalized for not knowing how to do each system. They will be teaching you as you go on. That being said, this really, the co-Pell scholars in general, we have tailored all of our programs to be as entry-level friendly as possible. That includes our program with the KGI Master's Thesis program. All of the individuals have been briefed that they're coming into these departments with a blank slate and that all of the background needs to be downloaded. In order to participate in the stroke program project, you don't need a background in neuroscience in order to do that. All of that will be downloaded for you, and all the pertinent information on executing it will be given to you by the advisor directly. My suggestion, though, is going into the interviews and to the candidate assessment and the application, just be able to confidently express yourself and your skill set and sell your soft transferable skills. They don't need to know that you have taken neuroscience classes and you want to be a neuroscience. That's why you're applying to STRO program. That's great. But what's really mostly going to sell you in this interview or candidate assessment, as well as most other interviews, are your soft transferable skills. Does that answer your question?
Yes, thank you.
The slide before that too. Yes.
Got it. So this links to our application. And any other questions? I'll take the silence as no questions.